Tell me action. Hello, my name is Dr. Danae Evie. I'm a physical therapist here at Bel Air Physical Therapy. Today we are going to talk about the hip as far as the AGMR, movement impairment. What that is actually Shirley Starman. She's a physical therapist that did a lot of research over movement impairment syndromes. So we're going to talk specifically about the hip and the leg. So AGMR is called anterior glide medial rotation syndrome. It's whenever your leg, you stand on your leg or you do a squat and the end, like we'll talk about a little bit later, is it rotates in and kind of pops forward. Anteriorly is forward, medial rotation is it rotates in. So if you want to see it here on the skeleton, the hip here, pretend this little guy, his name is Anatomy, as this guy walks forward, his hip actually rotates inwards. Oops, sorry, buddy. Come on over. His hip rotates inwards, causing his knee to move in, and this hip kind of goes forward a little bit as well, called the AGMR, anterior glide medial rotation. So what that does is that puts a lot of stress on the lumbar spine, on the hip, on the knee, on the ankle. And I'll show you that kind of in real time of what that actually looks like whenever you're walking, squatting, running. All this is due to muscle imbalances. So the muscle imbalances are all due to these muscles that are not supporting your hip properly. So as you're walking, it goes in. So all these muscles, your proximal hip muscles, your gluteus medius and your gluteus maximus, are not keeping your hip in the proper position and pulling it back, so that everything is in a good, proper, neutral position to reduce stress on all the surrounding joints. So let's go over what it looks like as you're walking or as you're running. I'm actually going to take my shoes off for this. And yes, my socks are different colors because that's who I am. Okay, so we're going to go over right leg. So watch this leg as I'm running. Let's see if I can. Let's go over that again. This leg. So as I'm running, that's a little bit exaggerated. A lot of other people's, it's very, very minimal. But even small micro traumas, every step you take or every step you take while walking, running, that can lead to further degeneration further on down the road. So slow-mo, as you come forward, my hip rotates in. You can see my knee rotates in as well. So whenever that is happening, look at my ankle too. Knee, ankle rotates in. So that puts a lot of rotation going on in the knee, causing pain possibly to your meniscus, your ligaments. And then as far as the ankle goes, it's causing that flat foot, that pronation. That also puts a lot of stress on the ligaments and the muscles. So as far as the hip goes, this view rotates in. Back view rotates in. As you're looking, watch my back. My back also rotates, and your lumbar spine does not like the rotation. The discs have to take up all the stress with the rotation, so if you do this all the time, it can create some discal problems in the back where there's pain here, and that may translate down the leg. So also another thing that it could be is with squatting. So you see a lot of times as people are squatting, your leg comes in like this. That can also be that same movement impairment with the hair bit. So as you come in, it's the same movement impairment as the leg is rotating in. So we need to work on all these muscles up here and train the leg so that it's in a better position. So I reduce my risk of having injury to my back, my hip, my knee, or ankle. So come on over, let's do some exercises. So since it's my right leg that is the problem, we're going to work on the right leg. Like I said, some of the major muscle groups to focus on, we'll go over a few, is your gluteus medius. Your gluteus medius muscle runs from your hip down to your hip. It helps you stand on your leg and pulls your hip out into external rotation. So proper clam is you're going to lay here. I think we went over this beforehand in some other videos, but you'll lay here, hips stacked, feet under your hips, knees about 45 degrees that way. I'm going to tighten my core so I know that nothing moves in my lumbar spine. The knee is going to push forward just slightly and then up like a J. I'm not going to rotate backwards. It's going to be right here, push forward, up, and hold. And I am feeling it right in here in my gluteus medius. And I'm going to hold it until I get tired and do that as many reps as I can. If I want to make it harder, I'm just going to elevate a little bit because I want to work hard so I can get better faster. So that is one exercise to do for the gluteus medius. Another exercise you can do for the gluteus medius, which is a little bit harder, and it can translate it to where you can do it in standing so that the muscle is strong in weight bearing while you run and walk, such as that. You're going to do it right here against the wall. Feet are right underneath your hips, and you're going to keep your hips straight across, and you're going to lift your other hip up as high as you can, just slightly, a few inches off the ground. And I'm going to be working and feeling my hip right in here for the gluteus medius. And you can hold for about a minute and do it on both sides. So that's that one. The other one we can do is lunges. So with lunges, what we're going to do is we're going to watch your knee. It's best to do this in front of a mirror so you can see if you're doing it properly. So with a proper lunge, feet right here, my knee is going to come right over my ankle and right over my hip. Everything's in a straight line here. I'm not letting my knee come inside. Here's my hip, here's my knee. I'm not letting it come inside. Everything should be straight. My arch should be up. And come on up. Hips forward as well. So this is a good lunge position. And this is going to strengthen up the gluteus maximus, which will also help pull the hip out. Pull the hip out so everything's lined up. And the next one we'll go over is just a proper squat. As you're squatting, you have to make sure that your knees stay straight. Arches up. Everything is in line. Your ankle, knee, and hip. Do not let it come inwards. So keeping it out, I'm going to maximally activate my gluteus medius so that I can get rid of that movement pattern and strengthen my muscles up in the proper position. Okay, so those are some exercises you can do to reduce that movement impairment so that you reduce your risk of injuring any of the body parts that we talked about. And this will also help if you have pain already in the lumbar spine, hip, knee, or ankle, it'll help with that as well. So if you have any questions or concerns, remember these are just general recommendations. So if you want some specific exercises that are going to help you with your concern and your pain, let us know, give us a call. I know everyone's staying at home just because the coronavirus, COVID-19, so just make sure you wash your hands, stay safe, and we're trying to do virtual visits, so if that's something you're interested in, give us a call. All right, thanks.